So for the Staphylococcus aureus and Staphylococcus epidermidis, basically these are gram-positive organisms. So you can see that Staphylococcus here, when it's grow in a blood agar, you will find there is a golden colony. On the other side, in the Staphylococcus epidermis, you will find these white colonies. Now both of them, or let's say the Staphylococcus aureus, will show you this grape-like organisms. Okay, now this organism will be more in patients who's having abnormalities in the polymorphonuclei, which is the neutrophil, and unfortunately this organism can destroy the granulation tissue and thus can lead to septicemia. It is the most important cause of surgical wound infection, okay, and especially on the suture or the area where there is surgery because of there is a damage for the blood vessels, okay, and it is a very important organism because it is a normal flora, and it can also infect the immunocompromised patient. On the other side, this organism, Staphylococcus epidermidis, it is more common in patients who's having aplastic devices. For example, a heart valve, or those who's having catheters or IV. Okay, so 50% of those patients, they will have this organism. Now, it also can affect these, cerebrospinal fluid shunt. It's also a plastic device. Now, moving to the third organism, which is Streptococcus pyogen. Streptococcus pyogen is a gram-positive arranged in pairs. This is arranged in cluster, and this is arranged in pairs. Okay, so you can differentiate by this thing. And this organism is a highly transmitted organism. Okay, and it is a very life-threatening, and for those who's sitting in the burn ward, because it can transmit easy. So this organism also, of course, it's very pathogenic. Okay, and it's more seen in those patients who's having freshly grafted wound. Okay, they will multiply there, and it is severely toxic, can lead to death if it is not treated, and the drug of choice is basically penicillin. Okay, now lastly, you can do this test, which is known as the catalase test, to differentiate between the Staphylococcus and Streptococcus. Now the Staphylococcus will do this enzyme catalase, will produce it, but the Streptococcus will not produce it. So what you do, you put this hydrogen peroxide in two tubes. Then you add the organism, which is the colony. Okay, the colony, that means one organism has been multiplied and give you like a colony. Okay, like this. This is the colony. Okay, so you will put it inside. If there is any positive catalase, will show you bubbling. Why? Because this produced bacteria will produce catalase, and which will lead to break down to the oxygen and water. The oxygen will produce for you the bubble. So this tube is for who? Is for the Staphylococcus, but this one is for the Streptococcus. And this is how you can differentiate between them, and you can also differentiate by the paired organism, like they are arranged in pairs, and this is arranged in clustered like grapes. Okay, and also the culture might help you. And thank you.